What should people be looking for? So, say that we're looking in the mirror, we're looking in the magnifying mirror, we're looking for these early detection signs. Is this like when it comes to aging
Right.
and that whole process? What are some of the first signs and some of the interventions that we can
Okay.
take on?
So when a person comes into my exam room, right, um, that is really where how I unwind the whole approach is basically the different categories, right? So that I like to look for color issues, right? Hyperpigmentation, redness. I like to look for then the fine lines and wrinkles. I think that complexion issues, sometimes you see that superimposed on fine lines and wrinkles and hyperpigmentation. Texture. That word texture has really one of the things that is amazing is this culture of beauty, that we have to start to really select words that are mean the same thing to all of us, right? Texture, I'll give you an example. People call up and they say, I want an appointment. And we don't know what they mean by texture. Some of them have dry skin, some of them have breakouts, some of them have rashes, some of them have surface roughness. It can mean anything, right? Because basically textures means I see it on the surface of my skin. So I have to dissect like all these different things. So I then look at hydration levels, dryness. I start to look to see, I can sort of tell whether a product agrees with people or not. And then we have to then begin like, okay, for example, okay, hyperpigmentation. That's what you were seeing. And this can come with any age group, right? You can see hyperpigmentation in younger people, birth control pills, darker complexions, sun exposure, not wearing sunscreen. Um, and the propensity runs in families. There's a tendency. So those are the big categories. And they're basically the same categories as in skincare. So, what you can do professionally and what you can do with a product, knowing what ingredients to use, knowing what your skin type is super important. It's a big part of the customization. You have to hone in on what's not going to make your skin irritated, right? Or if you have sensitive skin, it's a whole nother story. And sensitive skin is a skin type. I pound that message home to all my clients. It's not just about dry skin, oily skin combo. Sensitive is a skin type. So you have to sort of know what you're looking for, which of those categories. And by the way, sometimes it's a combination of things. It's fine to have fine lines and wrinkles, laxity or crow's feet, and hyperpigmentation or large pores or occasional blemishes. Let's get it all in. That's sort of how I approach it to begin with. And then I start to create products, right? And then I start to create products that I love that are multitasking, with all this in mind. So when I create a product, I am thinking I am creating this for all skin types and for people all over the world, and I love to give benefits for primary problems and secondary problems as well. Long answer.
I would love to get into the skincare piece of it, but I'm curious first, what do most people come to you with? What are these universal concerns that you're
Mm.
seeing? Is it things like the texture, whatever that means? That's kind of like a nebulous term and it has different meanings like you're saying, or is it the fine lines and wrinkles, or is it a combination of
Yeah,
everything?
there is no question that they're all of the above. Maybe the percentage is higher for people who want to address an anti-aging regimen, starting to see fine lines and wrinkles or laxity or sun damage in the past. They're concerned or they're starting to see it. The effects of sun are delayed. And I have so many patients in my mind who come in and they're starting to see the results of having too much sun. And I'll tell them that, and they'll say, "But I've been wearing sunscreen religiously for the last 5 years." That's just too bad, but the truth is the damage is done and it's delayed. Those free radicals that sun exposure set off years ago, decades ago, takes time to manifest. So, to answer your question, I would say fine lines, wrinkles, anti-aging, and then wanting to get a jump start on, things they're starting to see, and things that are full blown they want to treat. But then you have all these other things. Stressful lives leads to breakouts. Lots of travel can lead to larger pores. There's people who come into the practice who are seeing redness for the first time. Is that rosacea? Is that sensitivity? You got to work that out. You got to teach them. You got to dissect it, diagnose it, and then set them on the right track.